Hello and welcome to EJC News Focus, coming this month from Amsterdam, where the European Cancer Congress attracted 18,000 delegates. In more than 2,000 presentations, every discipline of cancer was covered. I asked the presidents of the various cancer societies what for them has been the highlight of the meeting. Martine Piccart is president of ESMO.
Probably the most exciting talk for me in this conference is the one given by Dr. Suzanne Topalian in the opening ceremony. In fact, I strongly suggested to the scientific committee to invite her for her great work in the development of new drugs that can manipulate the immune system. You know, immunotherapy has attracted many researchers in the last 30 years, but really, not much has happened, with a few exceptions, and it's only now that we begin to understand how we can effectively manipulate the immune system, how we can remove the brakes that the tumor is exerting on the immune system, reactivate the immune system, and the first results with these new targeted drugs are astonishing, because first of all, these treatments seem to work across several diseases, not only melanoma, but also, for example, lung cancer, renal cancer. And what strikes me is the quality of the responses seen in a significant number of patients. So we are talking here about long-lasting responses. So I really believe that this new development in oncology is one of the most fascinating ones, and I can foresee a future perhaps where we are going to become smarter at combining these new immune therapies with some of our best targeted therapies, and that this could well lead to major advances in cancer treatment.
Moshe Oren from EACR.
I would pick out the opening session Saturday morning, which had 3 presentations by Hans Clever, Bill Sellers, and Charlie Swanton, describing how you can go all the way from purely basic research into medical applications and drug development. And this was a very powerful demonstration of how basic research can have a major impact on medical oncology, and also a very powerful demonstration of the high complexity of cancer and how far we are still from answering the challenges that we are confronted with by tumor biology. And it was a vivid demonstration that without the continuous input of basic research and continuous exchange of questions and answers between the medical oncology community and the basic research community, medical oncology is still going to stay for a long time a trial and error business, and this is a kind of error that we cannot afford.
Vincenzo Valentini from ESTRO gives the radiation oncologist's point of view.
One was the Keynote Lecture for the ECCO Clinical Research Award, delivered to Professor Michael Baumann. He made an outstanding lecture on improved cure through personalized radiation oncology basis and perspective, helping the audience to do a fascinating journey from stem cell through the hypoxia, molecular imaging, dosimetric distribution, clinical outcome, and oncopolicy, to show in a very consistent, holistic view what is the modern place for radiation oncology, not only in the field of radiotherapy alone, but in the field of multidisciplinarity, and it was really great. Another interesting session was when was analyzed the impact of a local treatment, radiation therapy, through the immune system in having impact on systemic disease. There is this new perception that radiotherapy, a local treatment, compromise some message that the tumor spread, compromising the capacity of the patients to fight against the tumor through the immune system, will be really relevant. And so in some way change the paradigm. or because local treatment was thought for many years to act only locally. But in this way, we act locally, but we think globally.
Graeme Poston is president of ESSO.
Well, for me, I think there are two. The first came from our own society session, the ESSO session, and this was the junior part of the society taking forward the whole question of cancer surgery training in Europe. We are worried, we're in a state of evolution right now. The training of young surgeons isn't like it was in my time, where you'd have an open-ended apprenticeship and you'd work 120 hours a week, and you'd end up being made a consultant with probably 30 to 40,000 hours of training. Now, our young surgeons are expected to finish a finite apprenticeship in 6-7 years on 48 hours a week. So effectively, they're coming through with only 6,000-7,000 hours of training. And we know that their experience is going to be significantly less. So we've got to find a new way of training these young surgeons so that they're competent when they're let loose on the public at the end of their training. And so we spent a whole session discussing how we were going to do this, how we were going to teach them to operate in a much more limited experience capacity. And we would break down complicated cancer operations into small parts, and they would master each part separately. And over the course of their training, be able to put together the whole of the complex cancer operation. The second highlight for me has been the rolling out now of the Eureka project, which was started by Kurt van der Velde 4 years ago at the Berlin Congress. And what we've done initially was looked initially at colorectal cancer and primary colorectal cancer as an audit across the whole of Europe, taking national registries of outcome data from those countries which have collected prospectively. And only a couple of hours ago, I've just come from setting up the liver and pancreas audit for Eureka, which will start over next year. And we're going to look at a number of countries where we've centralized the surgery for liver cancer and pancreas cancer, both difficult and complex and dangerous operations. And so looking at the number of countries, United Kingdom, Ireland, the Netherlands, Denmark and Norway, where we've agreed that the surgery will be done at specialized centers for a population of very minimum 1.5 million, but ideally 2 or 3 million people, where you'd have 6 or 7 surgeons doing nothing but this surgery all the time, rather than the doctor doing 1 or 2 cases a year with very variable outcomes. And we will then roll this out across Europe and looking at the other large volume centers to look at outcomes, and hopefully encourage those European countries that haven't centralized this complex surgery to start doing so, because we know if we do this, the risks of the surgery, the mortality rates of the surgery, which historically have been 10 or 15% chance of being killed by the surgeon, come dramatically down to 1 or 2%. And also, if you survive the surgeon, your chance of being alive in 5 years' time more than doubles. So we're going to roll this out, and that to me has been a major achievement of this Congress.
To give the nurses' side of the story, Birgitte Grube from EONS.
One really important session we had on this Congress was the session for the anniversary event, where all the society's presidents was invited to talk about nursing through the last 30 years, looking at the past and also looking for the future. And one thing that was really very important for us and will be for the future also is the recognition of cancer nurses as a specialty. And we heard that the ESMO presidency said that they would work together with us to have that recognition in EU level. We've fought for this for years, and it's different in different continents all over Europe, but this is very special for us to have that recognition.
Cornelis van der Velde is president of ECCO.
What I personally engaged is, of course, the last minute abstracts, because those contain really practice-changing news. Usually also incorporate some award lectures, so you have some educational lectures preceding what is practice-changing news, whether to change from radiation therapy to surgery or vice versa, or to see, for instance, in the first presidential session, one of my co-workers, that chemotherapy still doesn't work in rectal cancer, but we can identify patients now better with a very good and a poor prognosis, so that it can help the view of the treating team and the patient what to do now. And that's, of course, the future, is individualization of the treatment based also on molecular biology, But there were a number of sessions indicating it's fascinating, but it doesn't help our current patients. But there are also large databases and a number of variables that really can pinpoint this is the best for this individual patient. Also with computer programs, there's the CHIVA trial presented here, and the conclusion is that the computer has a better judgment than the medical oncologist. But of course, it's an aid. It should help because there are other aspects than molecular biology, also comorbidities, the patient's social environment, what to do with this particular. So clinical judgment is still very important in this age of new technologies. But of course, I'm very excited because everything is here.
That's a flavour, at least, of the scope of the European Cancer Congress. And with thanks to all our interviewees, that's it for this month's EJC News Focus.